It's a topic many families don't like talking about. What are the wishes of a loved one who may become sick or injured? Now, you might not want to know what Grandma and Grandpa or Mom and Dad's thoughts on the matter are right now, but there could come a time when knowing their wishes during a crisis could be critical. Which is why Community Medical Centers offers families a service known as Advanced Care Planning. Advanced Care Planning is a plan for health care that is based on personal values, spiritual beliefs, and preferences. What many people don't know is that it's not just focused on the end of life, but is available to any adult at any stage of life. There's no easy way to plan for future healthcare choices. Just ask Lena Chambly, who has been living with asthma since she was a kid. Lena suffers from bronchial asthma and says she ends up in the hospital quite often.
Yeah, I used to be in the hospital about maybe 3 or 4 times a month, actually. It's really been hard for me.
One day while being treated at a pulmonary clinic, she heard a speaker who was talking about advanced care planning.
And I heard about how, you know, you can tell your family. You're able to tell your family about it, and you don't have to sit down and discuss it, because a lot of times families don't want to talk about death.
Lena brought along her 3 sons and her husband to talk with Sandra Benecourt, a social worker and Respecting Life Choices facilitator.
The social worker is there to advocate for you. So the social worker knows the ins and outs of the hospital. They're familiar with the different doctors, with the different specialists, the different resources in the community. And like I said, they're your best advocate. They're your best resource.
She asked me different questions about, you know, how I felt about it, you know, and so that's what made me feel good, you know, because a lot of times we don't explain to our people, you know, how we want things done. And like with my mother, I didn't know.
And Lena's son's reaction was a common one.
And it was like, Mom, are you planning on dying or something? No, that's not it. It's just that I want you guys informed to what my wishes are going to be.
Sandra says they may be hard conversations, but they are conversations that need to be had.
It's important to talk with your family. They are not mind readers. They don't know what your wishes are until you tell them.
And Sandra practices what she preaches.
I have my own advanced healthcare directive. I've talked to my family about my wishes because I don't want to put that burden on them. If something happens to me where I'm not able to make decisions, they already know what my wishes are.
And you don't have to be in the hospital or sick to get started on the process.
So we are hoping that these conversations are going to start in the clinic with the primary care physicians or with a facilitator, in this case, right now, the social workers.
Helping to provide peace of mind for families and patients like Lena.
They have this opportunity to express their values, what is important for them, what are their beliefs.
Respecting life's choices and planning for tomorrow while making the most of today. One of the most common forms associated with advanced care planning is making an advance directive, which names the individual's healthcare agent. Community Medical Centers is committed to inviting individuals to schedule an appointment with them in order to start the important discussion with their families and assign a healthcare agent. To learn more about how to get started, just call the number you see right there on your screen, 559-724-4258. Coming up on MedWatch today, lunchtime is the highlight of a child's school day. Make sure that time is both healthy and energizing by including the right foods. We hear from the pros next.